They say this is the most productive generation in Kenya's history. Energetic, unstoppable, innovative, resourceful. But yet, beneath the surface, we see something else. Beneath the surface, their hustle and their hashtags, we see a reality that is difficult to confront. If you go to our hospitals, in wards, we see 20-somethings there with cancer. In our rooms, the rooms where the therapists operate, desperation, stress, and burnout are the order of the day. And the people we're talking about are young, barely started in the so-called journey of life. What is happening? What is really, really happening to Kenya's youth? People who are feeding just to survive and not to add nutrition to their bodies. The numbers are scary, the reality even more so, and the future in jeopardy. My name is Victor Muyakane, and this is, of course, the People's Court. Tonight, we are shining our focus on the state of health, particularly for the youth of Kenya, because it looks like the youth of Kenya are dying young. So what is the future like if the future is under this sort of stress, under this sort of threat? We have a live audience in the studio with us. They're here to help us break this down. And we have a number of experts, a number of people with insights on this subject matter who are here to help us understand a little bit more about this. Here's how you can take part at home, wherever it is that you are watching us from. I want you to participate in this conversation in every way. Our producers are going to put a number on the screen, which is the WhatsApp number. It comes straight here, and I'm happy to read what you have to say and the questions that you may have to some of our experts. If you wish to share with us your views and reviews on SMS, there is 22047 is the SMS line. And if you're watching us on YouTube, the chat is live. I have access to it, and I'm happy to go through it and actually read what some of you are saying. I can see a number of people are already sending in their feedback, or rather their feedback on the news that we just had. But we should be able to capture everything that you may have in the course of this show. The conversation is about you and I. Everyone knows somebody who's gone through this, and we are here to find out exactly why. I'll give you a tip. We have a gentleman in studio who's a survivor. He caught cancer at a very young age, relatively so, and he's here because he has survived, but he's also here to tell us just exactly what happened and how he took that. With that out of the way, ladies and gentlemen, I'd like to introduce you to our team today, the people who are helping us break this down. And without any order of seniority, allow me to introduce first Madam Lillian Mutua, who's joining us from the Nairobi City County, where she serves as the health promotion head. Karibu, madam. Everything okay?
Thank you.
Karibu. Karibu sana. Next, we have Dorothy Omolo, who's a counseling psychologist. Karibu sana. Good to see you. Next, we have Beatrice Cairo, who's a health economist and a public policy expert. Karibu sana. You're not a stranger to this show, so I should say welcome back.
Asante sana.
Karibu sana. Next, we have Dr. Robert Kimutai, who's a hematologist and oncologist at the MP Shah Hospital. Karibu sana, Daktari.
Asante, Victor.
Karibu. And next, we also have the Reverend Joseph Kariuki, who is the Vice Chair of the Rural and Urban Private Hospitals Association, or RUPA. Karibu sana.
Good evening.
Excellent, excellent. And last but not least, we have Henry Derrick. Henry, of course, is a survivor, and he has the front row seat tonight. Henry, karibu sana. Everything okay?
Everything is okay.
Fabulous. This is not the first time we've seen you in this show, and I must say you look a whole lot better than you did last time.
Thank you.
So whatever it is you're doing, it's working. So hapo tu. Excellent, excellent. So guys, we have a studio audience tonight. Karibuni sana. From all over the country, from all walks of life, with all sorts of insights. Karibuni sana. All right. Now, we want to get into this conversation. And I want to kind of throw some numbers at you that are really concerning. Clearly, some of these numbers are saying that youth are getting sicker. You know, the younger people in this country, the so-called youth bulge, is actually under quite a lot of stress. We're looking at about 47,000 new cancer cases every year. This is I believe, let me get that for you. 47,000 new cancer cases every year. Here you go. That's quite shocking, okay? And cancer is actually one of the non-communicable diseases that is, a leading cause of death. 70% of patients of cancer are actually under the age of 50. And an incidence among 20 to 35-year-olds is actually sharply rising. These are just some of the numbers. The other thing they're saying is that over 80% of people who actually are found to be suffering from cancer are caught at stages 3 and 4. These are some difficult numbers right here. I want us to kind of get a bit of perspective. So Dr. Kimutai, I want to bring you in here for a second. First of all, you've heard some of these numbers. I believe as an insider, you have even better numbers. Would you care to tell us why are cancers striking younger patients now, or does it just seem like it?
Okay, thank you very much, Victor and TV47. On behalf of MPSHA, I'm really grateful that you've given us the opportunity to come and discuss this really important topic.
Karibu.
Indeed, the numbers you have given are right, and I think that only captures what is generally thought to be there. We actually think the numbers could actually be higher than what you have presented.
Wow.
Usually when cancer strikes or affects somebody, at that individual level, it's really difficult to identify the exact cause why they got cancer. And therefore, we do not want to, at the end, stigmatize and say, this is what caused cancer. But people who have done studies of following cohorts of, done really good studies, epidemiological and all that, have really been able to get associations between cancer and the issues like lifestyle issues, physical inactivity, diet, obesity, which has really changed. And I think you mentioned this with the younger generation. We are having seeing more of this happening. There's the mental stress aspects. There's generally abuse or misuse of alcohol, tobacco, or other drugs. There are other carcinogens which are actually found in food, which is with processed foods and all that. So people are taking a keener interest. Besides that, of course, environmentally, there are other things which happen in the background, like HIV/AIDS, which affects the younger people disproportionately sometimes. Other virus infections which are silent and we don't see those. But also compounded by this, what you mentioned, delayed diagnosis, people presenting stage 3, stage 4, because cancer usually starts at stage 1, stage 2, stage 3, stage 4. So by the time you really come to stage 3, stage 4, we are having a delayed diagnosis. So all this is really affecting the youth. Besides the other chronic diseases which we know are increasing, diabetes, hypertension, mental illness, the non-communicable other diseases that we have mentioned. So I think indeed you really struck it right.
It's really concerning, and I must say it's why in this era of information, there's so much knowledge out there. In fact, perhaps one thing you may have encountered as a doctor is people who come into your treatment room with an idea, right or wrong, of what they're suffering from. Dr. Google, Right. So in this era of Dr. Google, why are we still seeing things like that? For instance, we're catching these diseases late, even with the wide variety of information out there. What's a missing link? What's the issue here?
Yeah, so that's an interesting point in that as we've had the generational shift in things. We had the silent generation who the initial ones, the older generation who would go to their doctor, listen to their doctor and follow up everything with their doctor. As we progressed and saw this generational shift, you're right, people are becoming more digital, asking Dr. Google. We have AI, we have many other things that people are monitoring. But also, this is a generation also that you're seeing that there's also some bit of anxiety, other mental things, and things need to be done kind of quickly. So they want to understand things quickly. But in the same time, they're also very busy. And for some reason or the other, we end up seeing that we are actually having what we are seeing, a culmination of different non-communicable diseases and not presenting early to the doctors. So I think that is still a question probably our psychologists and other team members who can also come in.
Interesting. And clearly, of course, still on the matter of, catching these diseases late. There's a question of awareness. And Madam, at the county level, can you talk to us a little bit about what you guys are doing to promote things like early screening and things like awareness? Because it really goes, to what Dr. Ariye was talking about. There's still clearly a lot of, people that are not aware. And by the time you're showing up to hospital, you're caught late, stage 3, stage 4. There's 2 entire stages where an intervention could have been done. Talk to us a little bit about that.
Thank you so much. So for Nairobi County, we are privileged to have structures that run in the 17 sub-counties. And we have the health promotion team. We have also the CHPs. We have a team of the members who look into the non-communicable diseases and putting cancer as one of them, and also issues diabetes and hypertension. And there's a lot of awareness creation in the community level, especially when we go for outreaches and also at the household level. For our community health promoters, Nairobi, we are privileged that we have over 7,000 of them. Unfortunately, this work, most of them work in the informal settlement where they live. And this information is given at household level. And through their training models, they have a chapter where they are taught the basics about cancer, the information that they should share out, the key messages, inclusive of other NCDs. We also are promoting, especially for the cervical cancer, we are promoting awareness on prevention of the cervical cancer for the ladies, and we are also providing the HPV vaccine. For the male, we also include them in this conversation because even if not them, but they are also enablers and they should get the information. When we are saying 40% of the population is youth, looking at the population for Nairobi County, we carry the biggest burden of that 40% of the youth or the young people. So we are taking this information to the tertiary institutions. And when you look at the now revised school health policy, it has something on NCDs where cancer is one of them. So we are trying to create more awareness. When we are having the Cancer Awareness Month, we always have community engagements where we give services for screening, both the male and the female. And because of the introduced SHA registration and insurance, you can walk into any facility and you can be screened for free. So we are trying to reach these services not only in our facilities, but taking static in-reach and outreach facilities to the community. We are working with the churches, we are working with the learning institutions, and for the men, because it's not very easy to get them, either at the household level or even in our health facilities, we also visit the workplaces.
Right.
Yeah.
That's interesting. There's this, people in the NGO world have now, there's a word that's going around. It's called the youth bulge. And it's basically a projection, and I'm sure I can see a reaction from you, and we're coming to that. Something about how the number of youth in the world is going to shoot up beyond anything anyone has ever thought of before. I mean, conservative numbers in Kenya show that by the time of our next census, which is in 2029, and by the time the data is synthesized, we're going to have at least 5 to 6 million more youth. So from about 17 million to about 22, 23 million. And those are really conservative numbers by, let's say, 2029. But we're looking at a youth bulge that apparently they're saying about 70 to 75% of all people alive will be young people. And if these young people are going through what Dr. Ariye, that picture that you painted, and this is a serious thing. If you're talking about 7,000 CHPs or CHVs that are relied upon to take the gospel to really the underprivileged in the city of Nairobi, and even at this stage you're saying it's not enough. Can you imagine how that is going to be just a few years from now when those numbers keep rising? Talk to us a little bit about the impact of perhaps, underfunding and under-resourcing of these programs, how it can affect the youth and indeed the work that you do?
We will say that we are really riding on community engagement. And when we are saying community engagement, it doesn't mean at household level. For example, a learning institution is a community because these are people who share the same values, beliefs, and they even have their own social culture. So when we want to reach to this youth, we are looking at different angles. We could meet them at the workplace. We could meet them at the learning institution. The problem is also that the human resource might not be adequate. But then when we look at cancer, it involves a lot of community resource draining, both at household level, at individual level, at workplace level. So it's a conversation beyond health only. So we are looking at even multi-sectoral partnerships to take this forward. And not because of funding, but because we want to build resilience within communities, where communities can now go forward. Like you're saying, most people come to get diagnosed at stage 3 and 4. But it's because also we are a curative country. So we are also promoting preventive, promotive health, where you should just go to a facility and look at your wellness, not because you're sick, where you need to visit a doctor at least once or twice a year just to have a checkup and to know that you're well. So unless we reach that with or without funding, we might not go the right direction. Then the same youth that you're saying, they also Google when they have issues with their bodies. They're Googling and going over the counter. Maybe whatever you're treating is a danger signal, but you want to treat that signal. So it means they need to go to the health facilities, get a checkup, and also get information. As we know that the health workers are the most trusted information bearers for anything health.
Right. You know, so you said something really interesting, that as a country, we're a country that, focuses a lot more on curing diseases rather than preventing them. But even the process of curing these diseases and the process of spreading awareness, the process of, the checkups that you suggested, they happen in our hospitals. And apparently, correct me if I'm wrong, but majority of Kenyans access healthcare through private hospitals rather than government hospitals. I mean, you guys have the biggest network across the country. Can you talk to us a little bit about the cost of carrying the burden of these diseases, for example, cancer that we're talking about right now, and some of these new diseases? I say new because they haven't been seen, in these, instances in the young people that we have in the country. Talk to us about the cost of it. And as you digest that, Beatrice, I want you to talk to us, start percolating some numbers. I know you're a numbers person, about the economic impact of this on families. Because guess what? We have a guy here, Derek, who's going to talk to us about just how much it costs, not just financially, but otherwise, to fight, the disease that you got. So let's start with you, Reverend.
Thank you, Victor. I think when it comes to treatment, is usually very, very expensive. Ordinarily, we say that when we go to prevention, we actually save 9 shillings out of every 10 that was to be spent.
Really?
Yeah. So you can look at it on the other end and see when we are treating, we are actually wasting a lot of money.
Interesting.
And probably I should say, when we relook at these numbers that we are mentioning here, you will understand that 75% of our population is under 35 years old. And that tells you that there is a big number of young people that need to be taken care of. Apparently, where these numbers ought to benefit is not at treatment, because they are generally healthy. It is actually at the primary healthcare level. That is now where they should be going to be checked, like Madam is saying, at least once in a year, twice in a year. That is where they'll be, we will be able to diagnose a disease early, not at stage 3 or stage 4. And so when we prioritize PHC, we will be giving the youth of our nation a priority, because they are healthy. And in a social health economy, you realize that it's the young people who takes care of the old, and the healthy taking care of the sick, you know. And so for them, being the largest number of our population, are supposed actually to be taking care of the health of this nation. You talked about the cost for treatment. It's very expensive. And that is why we, even at the hospital level, we advocate for primary health care. I will give you an example. Cervical cancer screening and mammography has never been implemented in the primary health care program, benefit for the Social Health Authority. And this is where we should be diagnosing this thing at stage 1, at stage 2, so that we can be able to minimize the cost of treatment and also help these people and increase their chances of survival. So you realize that when it comes even to the social health fund, those diagnostics are not there. And they are supposed to happen at the primary healthcare level. So we need funding, and serious funding, because whatever SHA is having now for PHC, it's just a game, it's a play. They need to add more money to PHC so that we can be able to do these things. And remember, the PHC is being managed at the level 2, level 3, and some select level 4s, meaning that we are also reducing the number of people that will be going to the higher level facilities to be treated. And so we allow level 5 and level 6 to do the other major things that they should do. So if we concentrate on the primary health care and put a lot of money there, we will be getting it right.
All right, I hear you, and I think it's a point well made. Derek, walk us through this journey. Walk us through the story. They say ladies don't like to be told, to be asked how old they are. I hear that. But I hope you will not object to a question. How old were you when you actually discovered that you're sick? Talk to us about how you lived before and the day that you got the diagnosis. What was happening? What was changing in your life? And what prompted you to go and have a lookup or a checkup? And just paint that picture for us, Derek.
All right, thank you. All right, so I got my diagnosis in 2022, but I'd been sick for more than a year, actually about 2 years. And as mentioned earlier, I had consulted Dr. Google for
Dr. Google.
More than 1 year.
Right.
Yeah.
What was Google telling you? I'm curious.
A lot of, a variety of, solutions. I would Google even medications and go and buy them.
Wow.
Because in my mind, I knew that cancer was for a particular demography. So I never
older people.
thought, yeah, for older people.
So what were you treating?
So I would treat, bacteria infection, fungal infection, just to avoid, because some doctors would suggest biopsy, and I knew biopsy would unfortunately lead to maybe a cancer diagnosis. Right. I was trying hard to avoid that.
So you suspected?
Yes. After 1 year, I started suspecting because I used to read a lot. I'm also a writer, so I used to read a lot, and I started suspecting that this could actually be cancer. But the idea that I had cancer at that early age, was not sitting right with me.
How old were you, if I may ask?
I was 26.
26?
Yes.
And what sort of cancer did you... Actually, take us to the day you actually found out for sure.
All right.
The suspicions were now a reality.
All right, so unlike other cancer diagnosis, when I was told the 3 words, you have cancer, I felt relieved.
Really?
Yeah, because I had been in so much pain for more than a year, and we had nothing to treat. I was on painkillers, I couldn't walk, the financial burden, the meltdowns. So when they told me you have cancer, I knew that finally they have something to focus on. So, and I was diagnosed with Kaposi sarcoma, and literally we had no money. So I remember on the day I got my diagnosis, we organized the first fundraiser to start, because they told us on stage 3 and we need to start everything.
So they caught it at stage 3?
At stage 3, yeah.
Just hold for a second. Dr. Kimutai, help us understand, he's been treating it for about a year, before the diagnosis? A year
yes,
or
yes,
two?
A year or two. Yeah.
A year or two.
Yeah.
What if he went for screening, let's say, at month 2 or 3 of feeling like his body was not okay? What sort of stage would that have been? Just help us understand.
Okay, so to understand cancer, generally cancer is our own cells of the body which they go haywire. They start to multiply, they grow, the characteristic of cancer is that they invade. So if it starts, let's call it the arm here, or somewhere the spot on the cheek here, that is still stage 1. If it starts to invade, maybe it goes down to the glands, the lymph nodes here, then maybe that would be stage 2. Stage 3, maybe it has spread a bit more. Stage 4, generally spread to let's say the entire body, let's call it that way.
Right.
And that generally affects the outcome of treatment. If you catch it at this early stage, the treatment may be as simple as just surgery without any chemotherapy or any radiotherapy. These are the more intensive treatments. But once it starts to spread, then the treatments become even more. So you may need chemotherapy, you may need radiotherapy, and even more treatments that are available, targeted treatments and all that. So outcome is generally linked to stage.
To stage.
So the earlier you diagnose it, and
the better.
The better. So maybe at 2 months, 3 months, we want to think it could have been stage 1.
Stage 1,
2,
okay.
Because by the time he was diagnosed, he was in stage 3.
All right.
So that is why we want to say spot symptoms early and go to be checked early.
We're coming to you in a sec. Right. The particular kind of cancer he talked about, Kaposi's sarcoma. Talk to us a little bit about it. What does it do? What does it affect? And when you're at stage 3, what's likely going on in your body?
Yeah, so maybe I do not necessarily talk about Kaposi's exactly because they all behave in the same.
Yeah, just to give us a rough idea.
Yeah, so cancer is just cancer. Wherever it starts, if it starts in your brain, it starts in the chest, it starts in the leg, they all behave the same. They start in one place and then start to, if given time, they start to invade and spread just the way I described it.
Right.
So what happens is that cancer are not normal cells of the body. So the body recognizes this is foreign and starts to fight it. So your immune system becomes activated, and eventually it even becomes weak. You become susceptible to infections. It takes your nourishment, and eventually as you progress to stage 3, 4, you start to now see the manifestations of loss of weight, night sweats, and generally it becomes less and less curable as you advance towards stage 3, stage 4. But I would like to say that it's not a death sentence. Even stage 4s are curable. Stage 3s, because the biology of every cancer is different.
Yeah. Okay. Derek, listening to this and reliving these moments, I mean, so after the initial relief, now you have an enemy that you can identify.
Yes, yes.
The next stage was fundraising.
Yes.
What was going through your mind through that project? And talk to us about the journey from that moment of diagnosis to the point where I believe you went into remission, I believe.
Yes.
It was done.
Yes.
You're in the clear even now.
No, not yet.
Not entirely.
Yeah.
So talk to us about that journey from then till now.
All right. So I think I wasn't prepared for, because I just wanted to get through it. I mean, go through the treatment, but I didn't know exactly how the process, the tough the process was. So I literally went through it all. I started with chemotherapy. I did the first line, which was 6 cycles. Then I went to radiotherapy, then went back to chemotherapy, surgeries. So I did a total of 18 chemotherapies and 12 radiotherapies and 4 surgeries. And then I had another recurrence. Actually, I had 3 recurrences in between. So, and remember, we were fundraising along the way, for the surgery, for everything, for literally everything, for nutrition, for transport to hospital, for medication, for everything. And so, apart from the financial burden, there's the emotional part of it, because you depend on people to help you, and you need to be strong for them. So the days that you don't want to see the next day, but you have to smile, you have to give them that hope that you are, really going to get better. And the fact that it has really it had spread to my lungs. And, it was on my left foot, and it went to my lungs. And it was really bad that I even didn't want them to help me clean it, because I thought they would, change their minds and say, this guy maybe not going to get better soon. So I would struggle to be, to be normal, to pretend that I'm okay, I'm strong enough to clean it up and do everything. But I think in that journey, I've learned the power of community support, the power of, that fundraising and a bit of insurance here and there. But I saw my community, my friends coming together to help me, not just financially, but stay with me, to call me, to encourage me, and that really kept me going. Because I saw friends who just decide to rest, because of the meltdown, because of the financial burdens, and all that cancer comes with. They would just say, I'm not going to take this anymore, and stop treatment, and you hear that 3 months down the line, they're gone. So I decided to see how this disease was going to, to the next stage it was going. My entire life I've been living just beside one mantra, and this is, we live today, tomorrow will usually take care of itself. So I only make sure that whatever I need to do, I have to do it today. If there's something I need to eat, I'm going to eat it today, because tomorrow will usually take care of itself. So that has kept me going, and I think recently I had a recurrence, but I'm not as worried as I was when I got my first diagnosis, because I think where I was before was much, much worse than my current state. So I keep on fighting, hoping that one day I'll receive that remission.
Right.
Yes.
Listen, you're a brave man.
Thank
keep
you.
fighting.
Thank you.
I believe I speak for everyone in the room when we say, keep fighting, man. Keep fighting. You've done so well, and we certainly hope you'll keep fighting.
Thank you.
And finally conquer this. Thank you. And thank you for sharing your story as well. It's educative for a lot of people right here and at home who are watching us right now. Thank you. Thank you for that.
Thank you.
And we'll come back to you for a little bit more in terms of insights. Beatrice, you've heard him. He's talking about the economic. Talk to us a little bit about what he said, now the numbers of it, the economic impact on families. And are there any policy gaps that actually worsen, the impact on people like Derek and their families?
Okay, thank you very much. But let me disrupt. You see what he has talked about, what our lady here from the county, what Dr. has said, what Reverend has said. All these are the fruits of a healthcare system that is not functional. So now, as an economist, I'm going to discuss the root cause. And this is what we call in economics the social determinants of health. These are non-medical factors that can actually affect your health outcome. Before you see Dr. Kimutai, you've walked a journey because you don't live in the hospital. And I usually say, just like the father of medicine called Hippocrates says, let thy food be thy medicine. It is our kitchens that makes us healthy. Before I see Dr. Kimutai, it starts from my kitchen. But as governments and as policymakers, what are the 7 factors of the social determinants of health? The first one is economic stability. The reason why he'll fundraise is because most likely he's a young person, unemployed, no job, no work. So when a condition affects him, he cannot access healthcare or cannot even be tested earlier enough. Because why? He doesn't even have the funds. Now you talked about SHA. SHA itself will ask you to pay premiums. Okay? And they're telling the youth, I remember there was a policy that had introduced that every young person who is unemployed must contribute 1,000 shillings. From where? That's what the youth asked them. From where? Because for me to pay the premiums, I need to have a salary, I need to have an income. But yet 60% of the youth in this country do not have jobs. So obviously with economic instability, what will they eat for food? They'll eat chips and sausage fried in what kind of oil? Transformer oils that we walk on the streets of Nairobi. And the person who is producing those chips using transformer oil also has economic issues. And that you are saying the reason why we are dying young is because of economic and policy issues.
Okay.
So number 2,
We look at education access. The same young people with the same government, they've been told the economic funding model for the education system is no longer there. So what happens? So anybody is going to access education because this is where you get informed. You're able to analyze situations. You're able to have the analytic mind. You are not able to actually access it. Number 3, we have the built environment, or what you call our environment. For example, when you look at Nairobi right now, when you go to Kilimani, skyrocketing buildings, high-rise, the affordable housing that you're actually looking at, there are apartments. So where are the playgrounds? When she come and talk about mental health, where do we have nature walks? When they build our roads, remember most of our young people are using borders, right? So where are they going to cycle? I want to cycle. When they build the roads, yes, it's true, it's infrastructure. Where are the pedestrian walks? So when you look at, we have not even talked about accidents, the number of accidents that young people are dying at an early age. When you look at play parks, for example, the Kenya Forest Service recently added fees charges. So if I want to go to the park to actually relieve myself mentally, where do I have access to these parks? So when you look at our built environment, look at the houses they are building. They are building bed sitters. Do you know what is a bed sitter? Already you cannot even breathe, you cannot even discuss. I was expecting for affordable house care, there should be 2 bedrooms, apartments, and above. But they're giving us bed sitters. You know, you can imagine how psychologically it affects you. I know I'm not an architect, but I think there was a recent research that actually stated that when you live in very constrained environment, you know, when you call it minimalistic, it starts encroaching on your psychology. The next thing is mental health. The next thing, you want to kill yourself. The next, you can't breathe properly. How are our landlords? These are the policy issues. How are landlords building our houses? Do they have enough windows? Some landlords, you only have one small window, which is also the door. Are you imagining? That's how they're building those buildings. Right. So that definitely is going to impact your health. Number 3, we look at access of healthcare in its essence. So in this access of healthcare, when you come and say you're going to do universal healthcare coverage, how are you ensuring that 60% of the young people who are unemployed, they can actually get the premiums they deserve to actually be in that SHA? Now, recently, I think it's Mama Lucy Kibaki, a young woman who was miscarriaging, goes for an emergency care, but she's now being detained because of 6,000 shillings. And yet the CEO of that Mama Lucy Kibaki wants her to produce 6. From where? You know, will she go plant from trees? Now, last but not least, look at the governance and the policies. So when you look, for example, let me to cut it short. For example, when we look at healthcare, we think it's only one department called healthcare. But let me tell you, healthcare cuts across. If, for example, the person who owns this media station does not do occupational health safety, all of you will be having broken legs. So it means there must be a policy about occupational health. Now, if it's the farmer who is farming there in Meru, for example, there are high cases of cancer in Meru. Why? Because the nutritional value of the soil that the farmer actually plants the soil, it's already eroded. So it means in the agricultural ministry, I'm expecting what is the health policy in that agricultural ministry. Let's come all the way even to the education sector. What are the healthcare educational programs within our curriculum that can actually teach our young children to actually know, I need to eat vitamin A, vitamin B, I need to protect myself, because preventive is what Africa can do. Curative is damn expensive. Recently, in the year 2018 to 2019, actually, the government on non-communicable diseases spent around 50.6 billion. That's a huge amount. Yet the same government, when it's going to budget for preventive healthcare, only sets aside 11 million. Are you seeing how diabolical that is? Now, when you look at mental health cases, when you look at the budget, it's 0.01%. Yet, most of the young people are being affected mentally each day in, day out. You don't have a job, you live in a bed sitter with one small single window, okay? Look at it. And on top of that, you could be having an ailing mother, an ailing grandmother back at home because they cannot access healthcare, they cannot access nutritional food. The soil is already eroded, it can no longer produce crops. Right. So, the factors are so deep that unless we deal with the root cause, whatever all these people are discussing are just the fruit cause. And most likely, our survivor here, Derek here, could actually, if he walks through the journey, most likely, he was exposed by maybe Derek, you love eating fish, most likely, right?
I used to.
You used to, exactly. And you will realize that Mama Karai, the oil she's using are the seed oils. Yeah, the research has shown the same seed oils that are being accumulated within our body systems are the ones introducing these non-communicable diseases, bringing this cancer on board. So if that mama fish or the fishmonger, if she's able to be educated, the correct oils to use, maybe he would have fed on a very good, healthy fish, contributing to his healthcare system. Maybe if she is funded very well, she's a teacher teaching in class, she's telling people, boil your water, wash your hands, the soil, how do you test its nutritional value? Then it means even if I do not become a doctor or I don't become an engineer, I become a farmer, the kind of tomato reaching your doorsteps will actually be a nutritional one. And obviously, you may not actually need to visit that doctor.
Right. I think we just need a moment to digest all this. Thank you. It's quite a sweeping explanation here, which gives us just how interconnected everything is. I have a question for you guys at home and the guys in the studio. How many of you, by a show of hands, have actually gone to get checked in the last 1 year? You've been checked in the last 1 year. How many have gone to get checked in the last 6 months? 1, 2. Are you sure? And let me clarify. By checked, I mean by a trained health professional. See, mitishamba, I'm a native doctor.
Full checkup.
A full checkup. We're talking about a full checkup. How many have actually done a full checkup? Everything. 1 year, yes. Hii ni mitishamba hii. Madam, full checkup. What did they check? Which parts did they check? Anyway, interesting. And I have another question for you guys. You've heard about the stuff that's been said by our panelists. I need reactions. As they were speaking, I could see some of your faces. I saw your eyes go bigger, madam at the back. I saw your eyes go bigger. I saw you tighten up a little bit. The gentleman at the front, I saw you actually thinking very carefully, about some of these things. Let's hear some of your thoughts on this, man. Let's start with you. Please stand up and tell us your name and where you're from and what your point is.
Okay, thank you so much, Kenyan. My name is Victor Moore. I'm actually from Kenyan constituency.
I think the mic is not on. Would you please switch it on? The button should be somewhere there. In your checkup, did they check your eyes also? All right. Please, on a light note.
Yeah. So thank you so much. As I have said, my name is Victor Moore. From Winky North constituency, Mumbon Ward.
Karibu.
Yeah, and I want to first to give my nataka kuambia pole sana by the words of an American author called Catherine Scott. He said that the human spirit is very strong than anything that can happen to it. So soldier up, you're a man, and you have done it right now. You can continue doing it. So I can say about the topic of the day. What basically I can address most so for our young people, the young generation that you're having. And when you talk about the young generation, it's not basically about the Gen Zs and the Alphas. Even the millennials that are in the room, you're actually also young. So I can say what's the problem is the lifestyle that you're having. I think these some of the diseases that are coming along, it's because of the lifestyle that we are exposed to. For instance, I was given a story. A very prominent man, a leader of this country, Stephen Kalonzo Musyoka, we happen to come from the same place. If you can look at the age of Kalonzo, he's actually around 71. And we have been discussing what has made him look that way. Many people say he looks young. And then I was given a story, and this actually was given it by an old man, and he told me it's because of some of the diets that Kalonzo has been exposed to early in the days. And now we are discussing because if you actually look at our generation, we are exposed to a lot of mental diseases because maybe of the exposure to drugs and a reckless lifestyle. And as Madam there has actually said, your kitchen is actually where you get the preventive factors for you not to go and see the doctor.
So I have a question for you, Wambua.
Yes.
From what you've heard so far,
Yes.
Are you confident that your own kitchen, where you eat, whether the one you cook or the mama ntilie on the road, are you confident that your kitchen has your future, at heart?
Personally, I'm kind of challenged because, frankly speaking, and I'm not speaking on my behalf, I'm speaking on behalf of other friends that I know. Actually, our generation, we are kind of cooked of our kitchens and how we are trying to take care of our diets in order, making sure that you have balanced diet. But at the end of the day, I think also we have to get that mentorship on how we are going to do these things right. And on top of it, what I cannot live, I cannot sit down without saying Muyakane. On the other hand, we know prevention is better than cure.
Right.
Everyone can agree with me. Prevention is better than cure. So there are situations now whereby it's over the prevention and we are in the curative part. Now, how are we handling the curative part? Now it's where now the systems now come in, the systems shipping. 10.7 billion, I think. We are having the dispute whereby unasikia ati kuna madaktari wanataka kulaunda pesa kwa SHA, kuna pesa inapotea, of which there are people who are real suffering. Someone anaeka watu kama 10 ati wamevunjika mguu, mtu anavunjika mguu mara kama 5 in the same hospital. Now this money that should be used to actually deal with the real issues, it's being used kuwekwa kwa pesa ya wanaume. It's really bad, and I think there it's where systems tunafaa kuangalia.
All right. Thank you for that, Wambua. Let's hear from the lady right behind you. To balance the gender, please switch on your mic. All right. Let us know your name, where you're from, and what was in words, what your face told us when they were speaking.
Okay. My name is Jedida Mweni. I am from Machakos and a student at Jomo Kenyatta University of Agriculture and Technology. First of all, the reason why I have had a checkup for the past 6 months or so is because my university was conducting a medical camp for a whole week, and I think not many people knew about it because she's from my school. Do you know that we had a medical camp? Did you go for a checkup? But I think...
Did you go inside the tent? Or you just passed there? Okay, all right.
I think a large number of people didn't know about that, so the turn-up was not that good. And right now that most of the students have traveled back home because of the strike and everything that is going on, so you find that's a really good platform where people could come and get checked, but given the current circumstance, it's not even possible. She talked about bedsitters. Most comrades live in bedsitters, and some are very small to an extent. I can cook while seated on my bed. I can literally access my sink from my bed. And then you find there's no water. Water comes once or twice in a week. So what am I going to bath with? What am I going to drink for that 4 days that we don't have water? You find that becomes an issue. You feel relaxed in that bedsitter. You don't have an option.
Right.
You have to survive.
Right.
Yeah.
Right.
Anxiety disorders arise. Depression is arise.
Very.
Because when you go to your grandmother's home in the rural place, you have ample space.
Yeah.
How do you feel about it? Your skin even glows. Your heart is relaxed.
Yeah, you feel
but
better.
But when you come to Nairobi, by the time you go back, your face is even darker.
You can't even go for a walk unless you go inside the school and take a walk around when you're outside the school.
And that is cool.
So, Mweni unasema comrade anaumia.
Comrade anaumia.
Comrade anaumia. I want to hear from another comrade, the gentleman at the corner. What's your good name? Where are you from? Unaumia ama unafanyani?
Oh, thank you. My name is Steve Biko. I'm from Limuru, Kiambu County. Personally, I'm a senior comrade. I graduated some years back.
Yes.
But still, I can recall we were just surviving. For now, I want to pick.
Are you thriving now? From surviving to thriving? Are you thriving now?
I'm trying.
You're trying?
Yes.
What do you think about when you hear the words of our doctors here, our experts here, and Derek? What goes through your mind as a young person yourself? I would imagine, I don't want to speculate, but Derek said he was about 26. I believe you're in the neighborhood of 26, the neighborhood, either close or far.
We are just age mates, I think.
Okay, so how do you feel when you hear a young person such as Derek actually, contracting this disease that is really, really difficult, and you've heard his journey. What goes through your mind as a surviving former comrade?
What really goes into my mind, and mostly when I listen to our panelists, picking from their points, one common thing is coming out clear. And one thing that I would really want to talk about is the underinvestment in health sectors, more so in some of the health initiatives that targets our youth. There's a lot of underinvestment. And so I would really love our government if there are better funding models that can really target our youth to an extent that when such a cases like our brother here, our brother is talking about a time when he realized he had that particular disease. So going through that journey all along, we can clearly understand that there is underinvestment, that is one thing. There is misinformation, and there is just a lot that is going on. And we would really wish that the institutions that are responsible in funding our health sectors should look into this so that our youths do not get to be caught along the way. I think that is what I can speak about.
All right. Thank you for that. Dorothy, I want to bring you in for a second here. But just before I do that, I want to appreciate some of the people that are watching us online. We have people like Charles Mutua, we have Jeremy watching from Uganda, from Jinja in Uganda, and someone called Kudonjo. Thank you. God bless you. All right, I think we'll hold it off from there, but I can see your feedback coming in. Send in your feedback on SMS, on WhatsApp, and of course on the YouTube chat. I'm happy to sample that. Dorothy, I want to bring you in for a second here. And we're talking about, mental health has been mentioned indirectly and directly. Talk to us about what sort of mental health obstacles or enemies, or like what in the way of mental health are the youth of today facing? And is it different from perhaps other generations? And why?
Thank you so much, Victor. Allow me to start from the point of housing and how it comes in handy with where we are as at this generation. The housing kind of bed-sitters. First, it clogs your brain. Once it clogs your brain, as for the comrades, because most people that are currently in the country and sub-Saharan Africa, plus the worldwide, those that are affected by anxiety disorders, PTSD, insomnia, any kind of disorder that is related to your daily life is within your space. Now, the room is small. Breathing is a problem. When the breathing is a problem, then it means there's moisture in the house that you constantly accumulate. That already leads to health issues. 2, when your brain is clogged, then your brain will, because of its malleability, it will always find a way to, try to think. When it's not given that room to think, anxiety kicks in. Then now panic disorders kick in. While you're holding that, remember, we have social media. Now, when you can't sleep, you will find a dopamine. You'll scroll through the night. You don't sleep. Remember, you don't breathe well, you don't sleep.
Actually, interesting, just on that note, there's a phrase these days called doom scrolling. Apparently, when you start to scroll, and our systems are geared towards showing us the bad news and the worst of humanity. So that addictive nature even births more and more problems, as you described.
Yes. Now, you don't sleep, you don't breathe well. Now, your brain is already clogged up. You move into spaces. Now, remember, if it's comrade or even us millennials, plus the Gen Alphas, let me just say the current generation, because it's affecting all spectrums. Now, when you go out, remember, you didn't sleep. So you're operating on a sleep deficit. So we're not only talking of sleep disorders. We're not only talking of anxiety. We're not only talking of panic attacks. We're not only talking of PTSD. Where you're coming from, your parents cannot even afford a quarter of what you, quote and say, need while in town. That is for the generation that is that is going to school. And for the generation that, like us, the millennials, you have benefactors and people at home who are literally
dependent,
looking at you. End month to end month, these people put in, say, imagine in the city, you probably pluck some money somewhere. Now, you also have a generation to please. Apart from the black tax, you have your relatives, your friends that you also want to, please. There's also a lifestyle that you also
want
have
to flex, right?
to be in, YOLO. Now, I want to go clubbing, I want to go to church, I want to go to friends' party, I want to go to birthday party. I still have the black tax at home. Remember, if you don't pay black tax, especially people, I'm sorry, for the central Kenya, it always come like, you'll be cursed. I'll curse you.
Across the country, actually, yeah. if you, there's an uncle, everyone has an uncle in the village. If you don't send him that 500 or 1,000, they'll start saying you're proud, and then they'll curse you. There's also the risk of curses. The
risk of curses come up. So when we talk of how mental health intertwine, literally it's the backbone. But again, as when we looked at the budgetary allocation for mental health, it is 0.01%. It's really despair, because if Derek was able to understand that this is beyond panic attacks, this is beyond bodily aches, this is beyond insomnia, this is beyond, because when we are in a generation where we don't sit down to listen to our bodies, we are constantly on the run, we are constantly on the move. Life has to move on. So at what point in time do we stop to listen to our bodies? At what time do we realize that scrolling through the night is not right? At what time do we realize that, eating, of course it's nice, you drink, it's fine, but now at what point in time do we say that this is enough? At what point do we say enough is enough?
Dorothy, I want to throw some numbers at you and then tell us the mental health story behind those numbers, right? Okay. Even as the doctors will tell us the physiological, I think, manifestation of these numbers. Let me throw this out here. Apparently, according to the WHO, sugar intake in Kenya has tripled in the last 20 years. We are consuming 4 times more sugar than ever before. Yes. That's one. 2, apparently fast food outlets have emerged and grown at a rate of 400% in the last 10 years alone. And when it comes to something like physical inactivity, apparently only 20%, 2 out of 10 of young people actually meet weekly movement or activity targets. Talk to us a little bit about, and here's another one, the small units that we're saying, right, do the gang and so on. The air pollution in the urban centers, not just in Kenya, but across the world, has exponentially increased. We're talking about hundreds of % in terms of increase. What does those numbers, what reality does that create in terms of mental health for our young people?
Thank you so much, Victor. Actually, bringing up this is very beautiful. What I personally do when we start the therapy sessions, first of all, I take you off sugars, because sugar, in the current space, it's a dopamine, shot. Now, when you constantly have sugar, let me give a typical example of what happens in the human body so that, it's in a layman's language.
Right.
Now, I'm anxious. I can't really place why am I anxious. Then I'm worried, because the basis of anxiety is worry and fear of the unknown. Now, because I fear the unknown, I need something to remind me that I'm here, I'm loved, I'm accepted. Sugar is sweet. It creates a dopamine shot in the body. Now, this is a synthetic dopamine shot. Now, you become calm and feel good at that point in time. Now, that is when we have now addictions. People take sugars, people take candies, people take chocolates. I've had, I think, clients who'd, by the time we're meeting, I'm asking them, do you take sugars? Be like, Dorothy, I can't miss a pack of chocolate in my bag. There are people, even in the gym, they're still, chewing sugars.
Is this the thing where they say you're eating your feelings?
Exactly. To have it, that is it. Right. Now, everybody when the moment your mental space takes a different turn, it will always give you options. If this is hard, it's okay, let's move this other side. We always move to the comfort side. So those are comfort eating. So sugars is a comfort eating. Gives you current, some type of dopamine. When you talk about going on walks, a number of people go do that. Even when you organize for just people to show up, a few people do that. Because again, at what time do they want to do that? And they're busy on their phones. At what time are they supposed to do that? And life is not lifing. They're always on the move, you know? So they forget themselves. People are literally walking, tickling time bombs. People are walking sick. And a doctor will tell us what the sugar does not only to your reproductive health as a woman, and to your reproductive health as a man. Now, when we talk about the gut issues, doctor will tell us that, what that happens. Now, people are decided, again, it's the brain's functionality of leaning towards comfort. Everybody will find something that is comfortable, that gives them the need to feel that I am here, I am appreciated, I am loved. So that is the psychology behind the rise, especially of sugars. Life is not lifing, so people have to run for life. And as Beatrice said, last week I went to Karura. The fee is already up. Now, money is not there. People have lost identity within it. Of course, it's unemployment, but it has cut off the identity. You don't have the money, so it means you don't have an identity. You will have to do something to find that identity. Within the finding of your identity, you will constantly always lean to the easiest way out. And that's the brain's functionality.
Okay. So guys, I did ask earlier, how many of you have done a checkup, full checkup, right, in the last 1 year? And we all know the numbers. You passed by, madam, you passed by the checkup. You didn't go inside. You went inside to say hi to the doctor. It's all right, it's all right. I have a question that is connected to what Dorothy is telling us. How many of us in the room have actually undergone what I might call a mental health checkup in the last 1 year? Mental health checkup. How many of you at home have actually undergone a mental health checkup in the last 1 year? My director is talking to me in my ear and he says he's never gone since he was born, you know? And he, you have? You know what he says? And I'm actually relaying what my director is saying. He says he fears that if he goes to the mental health checkup, they will certify him as insane. So he'd rather avoid the diagnosis. And he's called Emmanuel Inonda. He's telling us that's his answer. And this is a reflection of where we are as a society. Maybe before I shift to something else, Dorothy, why are we afraid of finding out the state of our minds and hearts and spirits? Why are we afraid of that?
This is going to really come out not so beautifully, but the moment we do a lot of brandings, it makes people, it scares people off. When us counseling psychologists, you come and then the moment I tell you, you have bipolar. Now you start walking like bipolar.
Those labels. Right.
Now those labels sometimes scares people off. What if you just came and instead of branding you, I keep that branding to myself because it's not, unless it is a psychosis case that needs psychiatry, because counseling psychology and psychiatry they're interrelated but different departments. Now, if you came as a person, instead of me branding your name, so that you don't go outside there screaming, because again, it's the conditioning of the brain. Oh, by the way, nakwaga bipolar. Oh, you see like the clip of that Mzungu who was spitting?
Right.
Then all of a sudden he was like, no, I was psychosis. I'm psychosis, So it enables us. And then again, people fear, step back. I don't want to be branded. So while we continue to, sensitize the whole nation, the whole country, the whole world, that mental health it's not just basic, it's fundamental. You don't have to wait to stop sleeping. There was a day a lady called and said, Dorothy, I've not slept for the past 14 years.
Whoa.
I don't sleep. the first thing that goes through your brain is like, how? How are you even surviving? So when we make mental health awareness and mental health wellness, you don't have to wait to become depressed. You're feeling your brain, you're clogged, especially the brain fog, please go somewhere. When you wake up in the morning and you literally drag your body out of the bed, go. There's difference between sleep and rest. Most people sleep. That's why when they wake up, they're very tired. It means the body was not at rest.
So we're sleeping, but we're not resting.
A number of people sleep, but don't rest.
All right. Dorothy, I want to shift gears, but I want you to begin to prepare something that I will prompt you before the show is finished, which is in about half an hour, so we need to really tie it up together. Prepare this for us, for the people in the room and the people out there. A checklist, a toolkit of mental health assessment. We have seen, none of us has gone for a mental health checkup in the last calendar year, for example. So all of us, like you said, are ticking time bombs. We can just be having a show here now, so let's prepare a checklist for us to help us gauge where we are.
But Victor, they could
Science
be
to
informal. There are those informal mental health checkups.
Yes.
He is a reverend, and sometimes when I speak to my pastor, I don't need to go to a mental health checkup. But when I talk to my reverend and I cry to him, that's a relief.
Can I tell you something? Yeah? Some data showed us that these guys, the youth, don't go to church.
But they talk to them.
They say the church has failed. Anyway, on a light note. But thank you. That's a really, it's a really interesting
informal
point.
way of mental health checkup. Yes.
Exactly. So give us that checklist. How to gauge if you're not okay. And you said something quite powerful, and I saw you nodding, that a lot of us are sleeping, but we're not resting.
True.
And I dare to say something about nutrition. We are eating, but are we actually nourishing our bodies? Point to note. So prepare for us a checklist to gauge ourselves and a toolkit to fix ourselves if we can. Something someone can actually action in our day-to-day life. Make it practical. All right. Now, I wanted to shift the conversation a little bit to something else that's also really problematic here. And it's that we have, and Daktari, you're an oncologist, I believe, and hematologist, I believe. But you're specifically a pediatric of those things, right? You look after the young people. By way of solutions, you've seen the patients that walk through your clinic. You've seen those trends, and you've seen the patterns. You've listened to the people in the room. What can you tell us that helps us shift our minds from what Madame was talking about, being primarily focused on curing, and maybe spending a little more, by way of attention on preventing these things? These patterns that you see from the young people that come into your clinic, how can we prevent them? How can we make sure that we arrest these numbers? Let's talk about solutions. From where you sit, what do you tell your patients? And the people that are watching us today, who are now your informal patients, without consultation, what are you going to tell them?
I will charge after.
Right.
Yeah. So I think that's an excellent question. What we need to know is that cancer can happen to anybody at any age. You've just understood that I'm a pediatric oncologist. So cancer could actually happen right from the womb to the small babies, to the younger ones, the older ones, adolescents, and to the older people. But cancer in the children is quite a different scenario because, of course, they have not been exposed to the lifestyle issues. Of course, they don't smoke, they don't drink. Probably they have only lived on Earth for a very short time. So sometimes there's a genetic background to that. But we, like I said before, it's hard to pinpoint and say this is the actual cause. But now coming to the young adults and also the older ones, basically, I think the first thing will always be, let's educate ourselves. We need to know what are the symptoms for cancer. And some of the symptoms, I think Derek has elaborated on them, basically not feeling well and seeing symptoms which you can't really explain. You try to maybe Google for them and you don't get a right answer. So some common things if you're having an unexplained weight loss, if you're having night sweats, if you're having generally ill health which is not explained, generally, I think at the back of our minds, let's put it that cancer could be one of the causes. Then if you have lumps, things which are growing from the body, then you have to think, could it be cancer? Have a checkup early. But more and more, we are moving, there are many screenable cancers in adults. In children, not so much, but in adults, in females, you can screen for the breast, you can screen for the cervical cancers, you can really basically check for other cancers as well. For men, you can check prostate, even colon for both men and women. So screening programs are there, and MPSHA is also there. I mean, we do some of these screening programs. The one thing maybe I should have mentioned earlier on is let's take care of our children, have the vaccinations, have good health care, because those are actually preventative to cancer. Good diet, avoid obesity, avoid just from because it's like some research shows like some of this actually is programmed from right from birth.
Really?
This obesity, cancer, diabetes, and all that. So we need to just ensure healthy lifestyles right from the word go. Then we've done the screening. Then we want to diagnose early, so that if somebody, even if bad luck you get cancer, it is curable easily. But when you come like now to stage 3, stage 4s, we are often talking about more complicated treatments, spending more dollars in the healthcare system. From the healthcare system, we are draining, and I think Reverend has mentioned very well, sensitized right from level 1, level 2, level 3, the community, I think that has been mentioned. Really, everybody's involved. No, this is not a doctor's thing anymore. It is everybody is actively taking part in it. And also the mental issues, which surprisingly there's a link between your lack of sleep and cancer. Sometimes you don't understand it. So those are some of the things that I would say that we really need to do, and do them actively. I think we can reduce the rate from the picture that we see in somebody coming in, they're being sent to India when they're already, basically we are just sending our money to India. People are treating there and sending back to us people who are not in good shape.
Right.
Yeah.
Right. And indeed, they say, there's an informal saying in Kenya that we are all, or most Kenyans are one disease away from poverty. And it's incredibly, soul crushing just to imagine that, as hard as these young people are riding themselves to be able to make something of themselves in this world, their very effort might be the very thing that brings them down. And when it does bring them down, then, your hands are tied as far as finances are concerned. I mean, Derek was talking to us about the burden of having to fundraise for each and every intervention that you needed, and for something that you have to carry for all these years. I mean, there's a lot of weight there. There's a lot of fatigue there. And so I want to ask you, Derek, and I want to ask everyone in the room. So, if you had to change one thing to make this better, to make our health system better or more responsive, Derek, from where you sit, what would that one thing be?
I think I'd say we need to create more awareness, because I think most youth don't get tested because some still feel that cancer is for a particular demography. So they don't until it's really late. So we need to create more awareness that everyone should get checked. We need to, whatever they've said here, that we need to study our body. If there's something weird or there's something strange in our bodies, we can go to a nearby healthcare and get checked. But I believe, awareness and maybe prevention will not work if there's not proper policy from the government. So the government can also do a lot, when it comes to regulating these harmful products, and also funding cancer screening, cancer, education, and that can do a really much when it comes to regulating cancer cases and ensuring that everyone gets treated, gets tested earlier and gets treated. And this will also lower cost of treatment because, like the doctor said, when you get diagnosed a bit earlier, you only need maybe a single treatment Well, like unlike my case where I had to go through, all the 4 cancer treatment options, so which was way, way much expensive. So I'd urge everyone out there, if not gotten tested, you need to visit to a nearby hospital and get tested. And also, if from the side of the government, if there's something they can do to regulate whatever these harmful products that are in our market, it will go a long way in ensuring that cancer cases are reduced.
Thank you for that. Beatrice, I want you to prepare something. We'll come to you. There's someone who asked online, that asked this to The Economist: should Kenya create a junk food tax or something to, for just like they regulate the advertising and sale of tobacco and alcohol? Should there be, those chips joints? Should they have like a tax on it?
Heavily.
All right, Reverend, from where you sit as the guys who actually run the bulk of Kenya's health sector, the private hospitals, both in urban and rural centers, from where you sit, what is that one big policy change, or indeed any change that you would propose that would change the landscape completely, that would be able to effect the change that you spoke about earlier on?
Sure, quite. And let me start with the current one we are discussing about young people. As an association, we have given several feedbacks and policy papers for consideration to the Ministry of Health. And particularly when it comes to young people, we are advocating and challenging SHA and the Ministry of Health to have a specific benefit for the young people. And this is because these are the majority in the populace of Kenya. And the good thing with the young people is that if we lobby them to get into SHA, the advantage is that a number of them are very healthy. So we will have most of them contributing and they are not consuming. And that money could go to other cadres of people that need that service. And probably that is one of the problems that SHA has in terms of contribution. They have separated the young people from the contribution kitty, and they are the majority. And like I've said, they will contribute and they are not using, because much of the expense should be there at the primary health care, where they just go to see a doctor and come back home. They don't need to be admitted. Most of them are healthy. The other thing is that in that...
Sorry, let me take you back to what you just said.
Yes.
So this thing that SHA needs to focus on, a specific benefit or package for young people.
For young people.
Would you break it down a little bit? What would it look like?
We will need a package for the young people. I talked about cervical cancer screening. I talked about mammography.
Like the Dr. was talking about?
Yes. And some of these things that, drug rehabilitation and the like,
Would there be a mental health package?
Yes, a mental health package there, specifically geared for the young people. Let's have a proper education drive, education campaign to educate the young people on the need to join SHA, because there is a specific package for them. If we go that direction, we will be able to see a number of them come in. Because right now, as it is, there is no natural incentive for the young people to start contributing to SHA. No natural incentive. So there is, what am I getting? And whatever we hear about SHA is hospital stealing, fraud, people, DCI, and that is the communication that they have. What if we came out with a program specific targeting the youth? We go to colleges and universities, educate them on the need for social insurance. When we all come together and contribute, when one of us falls sick, this kitty will be able to sort them out. You will find a number of youths coming in to sign in for SHA, and because of that package. Secondly, we found very bad policies, which we have constantly advocated against in government. Where, for example, when a young man gets to an age of 25, whether working, whether he's still in school or whatever, they are supposed to register themselves as a household. These people are still job hunting. These people are still, some of them, doing their masters and that kind of a thing.
Senior comrades.
Yeah, senior comrade is, yeah. So if you say at 25, they have to be registered as a homestead, a household of themselves, then you are actually doing a disservice to them. The other thing is that even when they register, you want them to pay for a whole year at once. It is not possible for these young people. So some of these policies, we just need to have a hearing government, you know, to hear what people are saying, because these things don't need scientific, data to show you that they are not paying because of 1, 2, or 3 reasons.
Right, and you heard one of them say, Derek was saying, you live for today.
Yeah, you live for
Tomorrow
today.
will take care of itself.
Oh, sure.
So if you tell me about next year,
yes,
pay for a whole year. It's...
No, it can't work.
Okay.
And therefore, we are challenging the government. And that's what I would want to see. And we have written these policy papers and suggestions to government. Can you come up with a package for the young people?
Okay.
Can we have even hospitals and other centers incentivized to take education to young people about the social health?
Right.
Can we have, even employers, given an incentive to have the young employees of the company be educated, about these things. And I think that is one of the ways that I would want to see happen in the life of the young people, because this is the foundation of the healthcare in the country.
All right.
Yeah.
All right. To Beatrice and Madam Mutua, what would a truly youth-centered health policy look like for this country? Let's start with you, Madam. Just building from what he's saying, starting with a specific package, INSHA, what would be something that's actually youth-centered, youth-specific policy? What would that look like?
One, we have to identify what are the gaps and the needs for health in this cohort. And then look at, I always vote for community or individual orientation. How do they want that package to be provided to them? Like he has just talked about awareness. Awareness should not even be at household. For the youth is meeting them at their forefront. If it is at a learning institution, a workplace, in their social amenities, that is where you can drive that information. When it comes to the health package, we know the risk factors, inclusive of both the positive and the negatives. How are we going to screen them? For example, how will we screen someone who is, even help them to self-screen? I'm drinking, how do I know I'm going overboard? So the services that the youth would want, and most of them will not even just at an instant come into a facility. Is there a digital platform where they can ask questions and be answered, where they can self-assess before they come to the facility, and where they can have conversations? I love the space. I've managed to get into platform of different space, and the people who are there who are vibrant are youth. Can we even have such spaces with the youth advocating and talking about their own health issues? To couple that is that as much as we are going to look at how do we want to deliver this, when it comes to mental wellness and cancer and lifestyle diseases, when you get sick, then you need curative. That is where you land in health in our Kenya system. But the preventive promotive aspect has not really been onboarded. So how do we leverage on funding the model for preventive promotive health, where now people can be educated as young as if a child can go to a Sunday school and learn a song and recite some verse from either the Quran or the Bible, what can that child not get from health? So we need to adapt systems that are friendly at community level. The comrades don't need to think about screening because it's being offered in their institution, but these are values that they should grow up with. So a young child who is maybe even 4 years should even ask the parent, can you take me to the facility for my annual checkup?
Okay.
So we need to drive a community, a person-oriented agenda where everybody loves their health, wants to be the best in terms of health, and then where you need to remedy that, maybe you're sick or you have a certain issue, then that one now can be sorted. Right. And if we put more funding into preventive promotive, then we will now get quality services when it comes to the curative. So you can imagine that bulging youthful population, if even 10% of it gets the non-communicable diseases, another 5% or even 1% gets the cancers. Also the traffic accidents, coupling in there, are we able to give quality? So it's not just about healthcare systems, but quality. Right. And the quality will given, like what we have said, if you put 9 out of 10 into preventive, then the quality improves.
I see. I see. Thank you for that. Beatrice?
Victor, first, biblically, do you know anyone below 50 years is a youth? Because this is everyone who is productive.
According to the Bible?
According to the Bible. So ancient times, anyone below 50 is a youth. Be as it may.
All right.
Be as it may.
Okay.
First and foremost, when you look at the youth policies, one of the key areas that the government has to really work very hard is the economic bit.
Beatrice, I think some people in government are using that biblical thing to determine how long they should stay in power. If the Bible says 50 is a youth, then...
Because a 50-year-old is still productive.
Then a 70-year-old is just a former comrade. Please proceed.
It was a later. So, number one, youth unemployment must be addressed like yesterday, because an empowered youth can be able to afford nutritious diet, can be able to access those mental health care services, can be able to go for those screening that Terry is talking about, can be able to pay premiums for SHA. So if the youth will continue being unemployed, there's no policy about unemployment. Give incentives to companies that if you employ the youth, we reduce your taxes. They will employ the youth, they'll be part of the working force. Put programs where youth can participate. That will work very well. I want to thank the comrade who wrote about sin tax. It's called a sin tax. Yes, tax heavily anybody who is promoting unhealthy food. Tax Coca-Cola, tax those fast food joints, tax those seed oil companies, tax them heavily, because if you don't tax them heavily, the disease burden is rising each and every day. So that is one area the government, actually the members of parliament who are in parliament, should actually be the first thing they should operate, because it is affecting our health.
I think a lot of people agree with you.
Exactly. Tax the landlords who are building bed sitters with one window, which is also the same as a door. Tax them
when you can hear that.
Yeah, tax them very, very, very heavily. Then the third one is look at the public spaces. We must, as Kenyans, fight for our public spaces. Hallelujah. We must fight for them. Why am I saying that? Where will we do our exercises? Where will we do our cycling? Where will we do our earthing and removing our feet so that we can enjoy the mother nature? Where will we breathe oxygen? Tell us where, when you keep on building skyrocketing scrapers all over the city, where will we play our football? You tell us to talk about food. Should we only watch with chips and chicken as we watch football in Manchester? And yet we could have playing grounds where we can actually play the football itself.
For free.
The youth are energetic. Where do we release our energy? Where do we do our dances? Where are the halls to dance? Where do we practice? If I go do a TikTok dance in CBD, I'll be knocked off by a vehicle. The next thing...
Someone else will post that video.
Exactly. My phone is snatched. There's nowhere I can actually do my dancing. So government must introduce public spaces where Kenyan citizens can sit for free. In Nairobi, for example, right now, if you walked around, where can you sit and take a breather? Unless you enter a hotel, and if you enter a hotel, you have to order for a cup of tea with sugar, she talked about. Remember, I'm so stressed. I've been looking for a job with my papers. I have no job. That same hotel, look at the windows again. Look at the public health. There's a lot about the built environment. They have built very tiny spaces, congested.
And there's a matatu stage outside the hotel.
Exactly. So if those policies can actually be addressed, then number two, We should now focus, we should move away from a doctor-centered kind of a healthcare system to a citizen, or what we call a patient, or a client-centered kind of healthcare system. Because why are we saying that? So that when the architect is building a house, he has the citizen in mind. When the farmer is farming that causing cancer, they have the citizen in the mind. When the journalist is actually talking about the news and how they're doing news, some of these causes fear and actually reduces my immunity. He will think about the citizen. When the police officer is actually handcuffing you or hitting you in the head, he'll think about the citizen. When that politician is actually making laws in parliament, he'll be actually thinking about the citizen. Okay. But when you have a healthcare system that is only doctor-centered, they'll never think about the citizen. But now when you see a citizen, when I see that Mama Mboga who is at the reproductive age, then I will not go cluelessly removing Linda Mama. When I look at that young person who is actually living in a bedsitter, when I am a minister of environment, I will actually start cautioning those landlords, why are you building cancer? Because I have the citizen in mind. Because once you have the citizen in mind, you're able to create policies that actually benefit the citizens. And remember, if you don't do those policies better, remember, the expenditure will keep on going higher. And my final point, for every Kenyan citizen, remember this. If we don't solve our political economy, the top of it is our political economy. If our political economy is never solved, we will never ever have a healthcare outcomes at a positive. Talk to Sudan right now, they're at war, right? You can imagine the disease burden that is going to be very high right in that area. That tells you our political is where our root of all problems. Before even you see Dr. Kimutai, it begins from there. So once we solve our political economy as citizens, we'll actually have better healthcare outcomes.
All right, all right. I saw a number of reactions. Now, we have a little bit of time, or rather I should say we have very little time, but here's how we're going to use that. Remember there was a checklist, toolbox that we're about to receive from Dorothy. I want us to receive that, and then I want you guys to come in, and you guys will give us your parting shot. How about that? Deal? Excellent. And I see you're in full school uniform, ready to inject. Dorothy, give us this thing. How can we assess ourselves as quick as you can? How can we assess ourselves and find out whether we are actually okay or not? And what can we do about it as quick as you can, please?
Okay, so we'll do a quick checklist. One, the brain that won't switch off in the midnight from 2 a.m. thereabout, your brain won't just switch off. That is one. Two, you are doom scrolling. Things, you just find yourself scrolling and scrolling and scrolling. Three, you become short fuse. I call it short fuse. Hot-tempered. You know, people say, you know, I'm always hot-tempered. It's my personality. Dude, it's not your personality. Then again, you are functioning, you're fully functioning, but you don't find joy in the function. Another thing that you should also be looking at, the constant fatigue that kicks in. You sleep, you wake up, you're tired like you never slept. Another thing that we should be looking at is, apart from being hot-tempered, you check out. You are in the room and all of a sudden you zone out. You are with everybody, but you zone out. So these are very small nitty-gritty things that we should be checking out. I call them low-key depression because that is when they're starting to crop up. So
what do we do about it?
Now, what do we do about it? One, again, loneliness, it's also important. Right. Those comrades that are staying alone, it's not that good. Nowadays, people stay alone now. Please don't stay alone.
This is Toshiako Bedsita. What do we do about it?
Now, one, people should avoid staying alone for a long time.
Okay.
Loneliness causes a lot of issues. One, the moment you realize that at 2 a.m. your brain is not switching off, please, if you don't have a word to put it, then just text someone. Text a friend, text your peer, anybody. Just tell them, I don't know what is going on, but I feel I'm not okay. Now, conversation starts from there. Denial is always the beginning of all adversities. So the moment you realize that something is not right, I'm not sleeping well, I'm not eating well, I'm withdrawn, conversations nowadays just like, not my forte. You find yourself, pulling back away from everybody else. You find everybody else is noisy, and your temper is short fuse, you're not functioning well. Your job is no longer giving you the satisfaction that you need. If you can't talk to your pastor, please talk to a friend. But again, do not turn other people to emotional dump site. because they'll be taking. Now the question is, when they're also not able to perforate themselves and pour it somewhere else, now this person will be the carrier of all your problems.
I see.
Okay?
Wow. Dorothy, I think at this point we need to invite you for a separate show. All of us need to come for a separate show when it comes to mental health, because clearly there's a thing. Clearly, this subject matter is bigger than perhaps even the time that we have tonight, is bigger than the attention that has been given to it by our state, like you said, by our society, and our entire healthcare system. I certainly hope that we've all picked up something from this conversation, from sharing, from the people that have been here on stage. So I want to thank all of you for bringing in your insights. Thank you so much. Thank you to the comrades. I'm reliably and quite firmly informed that I need to let you guys go to bed. So can I say that I am deeply sorry that we may not have more time for other people. However, I assure you, next Tuesday we'll be right here talking about something that affects all of us. And I want to thank all of you for coming in tonight. Derek, I believe I speak for all of us when we say we wish you the best. We want you to come to the next show to talk to us about your victory and inspire more young people. And I think you said something that was quite important. Let's check that you checked at stage 3. If he had checked earlier, maybe things would have been a little bit different.
Yeah,
but you're a soldier, like Wambua said, and we wish you all the best.
Thank you.
To all the young people out there, you've heard the experts, you've heard from your comrades and your fellow citizens. Let us strive for a better future, a healthier future, I should say. My name has been Victor Muyakane and will always be, and I want to wish you a good night full of God's blessing. Let's meet next Tuesday, God willing, health allowing, and let's be able to tackle something else that affects you and I for posterity. Good night and God bless you. Asante.